Thomas Baldrick at 2014 ASH in San Francisco. With me now is Jeff Sharman. He is the Medical Director of Hematology Research for U.S. Oncology. Thanks for some of your time, sir.
My pleasure. Thank you for inviting me.
So let's talk about this phase 3 study that you're here presenting data for.
Yeah, so this was a study in patients with relapsed chronic lymphocytic leukemia. This was one study amongst a portfolio of studies leading to approval for Idelalisib in this setting. This is the first study to read out. There will be 2 other studies within the relapsed CLL population, and this study focused exclusively on those patients who were deemed inappropriate for chemotherapy. So these are really the most beat up CLL patients you could find. They were on average 70 years old. They'd had their disease for 9 years. They'd gone through a median of 3 prior lines of therapy. And to get into the study, you had to have either kidney failure or really bad medical problems that limited your ability to get chemotherapy, what we call the cumulative illness rating scale, or your marrow had to be so beat up that you couldn't really get chemotherapy.
Why did you feel it was so important to do this?
Well, this is an unmet medical need. These are patients who practice patterns would suggest frequently get Rituximab monotherapy. And Rituximab monotherapy is considered by most investigators to be an inadequate regimen. Yet, we also know it's the most commonly utilized regimen. And I think part of that stems from the disconnect between the patients who are routinely seen in clinical practice versus those who tend to populate most prospective clinical trials. These were more your community-based patients who were at the end of their ropes.
What were some of your key findings?
Well, the key findings were that the progression-free survival, the risk of progression was reduced by 75%. We saw that the risk of death was reduced by over 60%. We saw a response rate difference of virtually all versus none. It was just one of these knock your socks off type differences between the control and the experimental arm.
So what do you do next with this information that you've gained?
Yeah. The management of patients with relapsed chronic lymphocytic leukemia is undergoing tectonic changes. There have been 4 drug approvals in CLL in the last 12 months. Ofatumumab in the front line, obinutuzumab in the front line, but ibrutinib and Idelalisib in the relapse setting. And where we go next is really trying to figure out optimal combinations, optimal sequencing, improving upon side effect profiles, and how do we make this an easier combination for patients to receive.
Very good. Thank you, Jeff. Appreciate it very much, and good luck to you.
My pleasure. Thank you.